Go.
In the beginning stages of treating a patient with a Spondy, we'll begin with child's pose. And this action focuses on trunk flexion and stretching, which will help relieve pain. After this, we can move on to supine 90-90 with 90 degrees of hip flexion and 90 degrees of knee flexion. And moving into extension will help work on the abdominals. Increasing core strength will help stabilizing the core and the lumbar area. While the patient's in phase 1, they can also continue to do stationary bike to preserve their cardiovascular training, as well as underwater treadmill, which is less pressure on the spine and will continue to work on cardiovascular strength or cardiovascular conditioning. Moving on to phase 2, they can begin with crunches. And again, this works slightly on the core for stabilization, then moving to bridges. This helps focus on the posterior pelvic floor or posterior pelvis. And then moving to clamshells, again working on the posterior chain. And lastly, side planks. And to continue cardiovascular conditioning, they can continue to do stationary bike and underwater treadmill and possibly move to elliptical or treadmill. And moving into phase 3, they can begin with sit-ups. Again, focusing on the core and strengthening for stability. And after sit-ups, they can move into squats. This can be progressed with TRX bands or half-body squats. And final progressions can move to a body squat with a medicine ball, adding weight. And to transition to functional movements, they can begin activities that are similar to their sport, but low velocity, so slow motions, but still focusing on technique. To discharge them from this final phase, they'll need to exhibit normative strength, no pain, and proper technique.